Hi again. We're going to discuss immunity as it pertains to systemic lupus erythematosus. This is Alicia Bright again. This is the face of lupus, you might say. It's an example of the butterfly rash that we associate with systemic lupus erythematosus. Uh, we don't see this all the time, but this is sort of what you think about, associate the butterfly rash with lupus. Lupus is a multi-system inflammatory autoimmune disease. It's complex. It is associated with genetic issues, hormonal issues, environmental issues, and immunological factors. It affects the just about the whole body: the skin, the joints, the serous membranes, the lining around the lungs, the pleura, the pericardium, or the lining around the heart, the kidneys, the hematologic system, and the neurologic system. It's marked by an unpredictable course. There are alternating periods of remission and exacerbation or worsening disease. About 250,000 people in the United States have lupus. Women are 6 to 10 times more likely to develop lupus than men are. It mostly involves women of childbearing years, and it's more common in African Americans, Asian Americans, Hispanics, and Native Americans than it is in whites. We don't know what causes lupus. There is probably a genetic component. There are multiple genes that are involved, but there does tend to be a tendency among families to have lupus. There are hormonal influences. A lot of times the disease starts around the same time that menses does, that women start having their periods. Or it might start when they start using oral contraceptives, or it might start around pregnancy. It might get better during pregnancy and then get worse in the immediate postpartum period. Remember, we mentioned that the immune system is a little bit suppressed during pregnancy, and so it actually affects how the body would respond to lupus as well. You'll learn more about that in OB, Women's Health. So there are also environmental factors that involved, such as the sun. Sun exposure. If people are under a lot of stress, it can make it worse, and exposure to chemicals and toxins. These things make it worse, and it's thought that they could even trigger lupus. Viruses also may stimulate immune hyperactivity and cause lupus to start developing in someone. And there are about 40 medications that might trigger lupus. Procainamide, hydralazine, and quinidine are examples of some of the medications that might trigger lupus. Basically, lupus can be viewed as an allergic reaction to your own DNA. It causes an autoimmune reaction against constituents of the cell nucleus, particularly the DNA. And what happens is circulating immune complexes with antibodies against DNA are deposited in the basement membranes of the capillaries in the kidney, heart, skin, brain, and joints. So these complexes trigger inflammation that cause tissue destruction. These overaggressive immune responses are also related to activation of B and T cells, and specific disease effects depend on the involved cell types or organs. So there's a great deal of variability in terms of what kind of symptoms people experience and when they experience them. The severity is extremely variable. Some people will have a very mild disorder, and other people will have a very rapidly progressive disease. It, as we said, affects the skin, the muscles, the lining of the heart and the lung, nervous tissue, and kidneys. In fact, it can involve just about any organ in the body. Remember, we've got DNA all over our bodies. So we can have problems with skin. This butterfly rash is an example of it. And there are other kinds of rashes that can happen. Neurological problems can happen, hematological problems, GI problems, reproductive problems, musculoskeletal problems, urinary problems, and cardiopulmonary problems. As we said, it can involve just about any organ of the body. So, what are we going to do about it? Well, the drugs that we use include, we lean on NSAIDs a lot for the pain involved, and there can be mild joint pain and pain in other areas of the body. So pain management is a factor. There are also anti-malarial drugs that seem to work to some extent to eliminate or to modify effects, such as hydroxychloroquine and chloroquine. And you've been hearing about those when we talk about COVID-19. Those are not proven efficacious, and there are some pretty heavy-duty side effects associated with them, including cardiac problems. A large percentage of people who take those medications have cardiac problems. So those are very heavy-duty drugs that modulate the immune system and might have some effect on lupus, and we use them occasionally. We might use steroid-sparing drugs or corticosteroids. And this is one of those situations where you might end up with Cushing's disease because it is more desirable than lupus is. We'd also use other immunosuppressive drugs such as cyclosporin, which is an anti-rejection drug. What's really important in terms of nursing considerations is to balance rest and activity. These folks can't handle stress. They need gentle therapeutic exercises, so physical therapy is going to definitely need to be involved. These folks need to live in a bubble. They need to avoid stress. They need to avoid infections. They need to avoid chemical exposure, and they need to stay out of the sun. This does cause photosensitivity. So we will focus on whatever problems they're having: impaired skin integrity, impaired health maintenance, ineffective protection, whatever they need. I want to point out that there is an excellent case study, an Elsevier case study online, and I encourage you to work your way through it. And I encourage you to look at this functional health pattern assessment. I'm just going to briefly introduce you to it here. Functional health patterns are a framework that's used for obtaining a nursing history. And there are multiple categories. I'm going to kind of go through them with you a little bit. And the only reason I'm talking about this is because they use it to assess the person in the case study on lupus on Elsevier. And it's a very good case study and a very good way to think about an assessment. So don't worry about having to learn a whole new assessment pattern. Just take a look at that case study and see what they say. This includes, they look at how people are perceiving their own health and their own management of their own health. They look at nutritional metabolic patterns. They look at elimination patterns, activity exercise patterns, sleep rest patterns, cognitive perceptual patterns, perceptions of the self-concept, relationships with other people, sexuality and reproductive patterns, coping and stress tolerance patterns, and value belief patterns. So these are aspects of the way that people manage their health and manage factors that affect their health. It's just an interesting, a different way of assessing a person. So I encourage you to get in there and do this case study and look through the functional health patterns that they discuss and think about how you would assess somebody with a complex health problem. So lupus is an example of that. Multiple sclerosis is an example of that. Rheumatoid arthritis is another one. And cancer is yet another one. We'll be talking about cancer again later on in the semester. So, to review, how do you support a healthy immune response? So all of these things would support somebody maintaining a healthy immune response, and they're also very important for somebody with an altered immune response, especially autoimmune diseases. Nutrition, exercise, immunizations, good sleep, and stress management, getting out and being with nature. All of these things are very important to supporting your individual health and the health of people with any kind of autoimmune issue.